religiously. And simple things at home. When I come back, I take off my shoes outside the house. I don't bring them inside. Inside, I have my other slippers which are there.
Yeah.
So half of the filth which is there, that is taken out. Then the other thing which I never used to do, I'm doing it nowadays. I straight away go to the bathroom and take off my clothes and wash my clothes myself.
Okay.
Because after you have washed the clothes which have been soaked in hot water for about 30 minutes, the chance of they being virulent with the virus are very, very less. It is never zero.
Okay.
So that is another thing I do. And after that, I keep on washing my hands every 2 hourly. And I have my mother there who's elderly. She's about 80 years old. So given a choice, I don't come in too much physical contact with her, but we keep on talking at some distance.
Okay.
And I try to practice a healthy lifestyle. I try to, because we keep on getting calls in the night. We sleep in between the calls. And I try to eat nutritious food. I try to do some exercise at home. I got a treadmill. So 10-15 minutes in the morning, 10-15 minutes in the evening. I try to regimentalize, but then sometimes I slip. Then, doctors are humans first.
Yes.
So these things I have not let down for the last 3 months.
Typically,
So that is how I do it.
I have to tip my hat.
Dr. Talwar, we have Dr. Rajat Gupta joining us from Delhi. And Dr. Rajat, good evening and welcome to IVM TV Met Friday. And we have Dr. Talwar from Rajiv Gandhi Cancer Institute. And we were discussing about the current issues, what's happening in Delhi. What's your take on that?
Hello, sir. Good evening. Hi, Ankit.
Ajay, good evening.
Hello, everyone.
Yeah.
So, the current take on the current pandemic is that the number of cases are increasing because, as per the central government, they are increasing the number of testings. So, definitely, we are going to get more cases. But we are living with it. So, people are less scared now. I see a lot of people out on roads. So, we are living with COVID. So, I think Sir has summed up all the necessary precautions we need to take as individuals. So I guess more or less everybody is doing that. So rest is luck. So whatever happens will happen. So we have to live with it.
And Dr. Talwar, before you leave, I have a last question from you. That how important is the zinc to take it at this point of time, to consume it, to make sure you have built up some kind of immunity with the zinc tablets? Would you subscribe that tablet?
There are studies which show that zinc has some benefit, not directly but indirectly. Along with that, vitamin C is there. So our COVID patients, whenever they get discharged, we give them a B complex. And nowadays we have certain B complexes which are combined with zinc. I won't tell the brand name because otherwise, it will get outside the chemist shop within no time. And so you have zinc alone or zinc with B complex, then you have vitamin C. And the other things which, I told, a healthy lifestyle and regimentalized, you have good sleep, you have good food, try to do a little bit of exercise. I think
I've heard a lot about vitamin D3 in terms of immunity. What do you think? Yeah.
You're right. Vitamin D also, there are certain studies, and they can be given, vitamin D can be given once a week for about 4-5 weeks, and after that it can be given once a month for another 4 months. And it is,
so not daily.
supposed to boost up the immunity. In fact, both vitamin C, D, and B complex with zinc, they can be given safely.
I take it daily. Is that too often?
Yeah, I take it daily too. Should I be concerned?
Pardon?
D3. We take it daily, Sarah and I. Is that too often?
D3 should not be taken daily because, unlike vitamin C is basically a water-soluble vitamin. You take even a kilogram, whatever the body requires, it will consume and rest will go out in your urine. Vitamin D is not water soluble, it is fat soluble. It will stick around in the body and it can cause hypervitaminosis, a condition in which it might act the other way around. So one has to be careful with vitamin D. You take it on a weekly basis, don't take it on a daily basis, and after some time you have to take it on a monthly basis. And
How do we
in
know that's
between, if
happening?
possible,
I feel it now too.
this is not to scare you. You can get the vitamin D levels checked in between, and if they are normal, then probably you can stop for a while and then restart it later on. But vitamin C you can take, B you can take, because B and C are water soluble.
Yes.
So it can go outside the body, whatever the body does not require. D is a totally different issue.
Okay. Thank you so much for that information.
Yeah, no, really, thank you very much for that information.
Okay. So I think I'll take leave. It was lovely chatting with all of you.
Namaste.
Thank you so much.
Looking forward to host you again whenever you are available. Thank you, sir.
Sure.
Thank you for helping us out during the pandemic.
It will be my pleasure. Thanks a lot. Thank you.
Thank you.
Bye. Bye.
Whew, Jim, you might have just saved our lives.
So, Dr. Rajat, a quick question from one of our viewers in Morocco, and she wants to know that there are a lot of people who are going out doing exercise and wearing mask and not wearing mask. So, what do you suggest on that? Because do you think we should go out and do all those exercise and morning walks?
See, that about wearing masks is, as per the World Health Organization, is that people who have symptoms or who are having cough or sneezing should ideally wear a mask. So it's not mandatory for all of us to wear masks, but in Indian scenarios, it is better for all of us to wear masks because a lot of patients are unaware about the severity of symptoms or the intensity of they can infect the other people. But if you are in a surrounding where you have a lot of educated people, you can probably walk around in the parks without a mask even. But it all depends what kind of population are you catering. Because if a person is educated enough and having symptoms, they will not move out of the house or move out of the house with a mask. So that's very important.
Because we can see that in especially in Delhi, a lot of people are going out, maybe wearing masks and not wearing masks. But nowadays, people are going out for morning walks and a lot of exercises, and they don't. I believe that they are not following those social distancing anymore, and so we are a little concerned because that could hamper your life and that could hamper our life as well. Because the disease can spread anywhere at any point of time. It won't call you and tell you that I'm coming and you have to be secure yourself.
Exactly. So the thing is that education of a patient is very important. We should be well educated about the responsibility as social citizens. We cannot just move out with coughing and sneezing all around like we used to do in the past. We have to be careful. If you're having symptoms, it's better to be at home or at least wear a mask when you go out so that you don't infect the other people. But again, so that's what they say, that you have to learn mannerism with COVID. If you don't have mannerism, it's going to be very difficult in coming days.
So I almost have like a responsibility when I'm at the grocery store and I see someone who's not wearing a mask and sneezing or coughing to kind of like give them a look like, exactly. For the betterment.
As long as he doesn't feel offended.
No, I think it's very interesting. You're talking about an educated population, but we can't take that for granted. I mean, I know people that are going around thinking that I'm a tough guy, I don't have to wear a mask. And so I can't assume that the people that don't wear masks are educated.
Exactly. So like there could be asymptomatic carriers. There might not be any symptoms, but they might be carrying virus, and if they cough or if they sneeze, they can probably infect you. So it's always better to protect yourself. So think everybody is not educated and treat yourself as the most educated person. So wear a mask and take precautions.
And also, I think the definition of tough guy has been changed now. People who are tough, they are wearing masks now. So I think we have to change the definition of tough guys.
And I would like to add one thing regarding the vitamin D3 we were talking about. Now, vitamin D3 supplements are available in various strengths. So it is the international units. It's the what we are concerned about. So if you're taking a vitamin D3 every day, which is around 1,000 international units, you can take it every day. But if you're taking a 60,000 uh, international units vitamin D, then you need to take it weekly. Okay, so it all depends. Just check out the concentration of medication you're taking of vitamin D3.
I have a question for you, Doctor. So with the D3, if I were to take a 60,000 one once a week, it does the same thing for me, right, as doing it on a daily basis. Is that right?
Yeah.
Okay, well, work smarter, not harder, right?
The whole concept of D3 60,000 and 1,000 is 60,000 is meant for clearing the deficiency. So people who are deficient with vitamin D3 needs to take a higher dose. Vitamin 1,000 international units is a maintenance dose. That's what you require for daily maintenance. So it all depends whether you're covering up your deficiency or whether you're doing a maintenance thing. So you need to get your D3 levels test and then take it accordingly.
Very good.
But Dr. Rajat, would you also suggest that if people don't take D3, they can go out and sun, they can take the sun bath, and also they can consume a lot of garlic and eggs and fish and things like that?
See, in the Western world, Ankit, a lot of milk products, eggs, everything, yolk is a very, very rich component of vitamin D3. Sunlight is one of the best sources of vitamin D3. And even in the Western world, we have a lot of food which is fortified with vitamin D3. So you can definitely enrich yourself. You don't need to take supplements for that. But yes, in Indian scenarios, we don't have much food which is fortified with vitamin D3. So sunlight would be the best thing. So early morning sunlight, right now, it's like very hot in the afternoon. So probably around 8 or 9-ish, half an hour, direct exposure to sunlight, not through glass, is the best source of vitamin D3.
Okay.
A long time ago, when I lived in India, we had bread fortified with A plus D3. I don't know whether that has changed, but I know that Modern Bread, which was one of the bread brands, and Wibs had their premix. I used to sell those premixes to these bakeries, and they used to buy large quantities of A plus D3. I don't know whether that's still going on. Any idea?
So I still have to check it out. I am not aware about that.
Oh, that's it.
So
Okay.
nowadays, Britannia is one of the very famous brands
Yes.
in breads going around in India. So I still have to check out with that Modern brand. But yeah, if you have breads fortified with vitamin D3, nothing like it.
Well, Dr. Gupta, I wanted to just back you up on getting early morning sunlight, because if you have a skin tone like mine, I burn and peel. I do not tan. So, but the early morning sunlight is fine for me. I can go out and get it in the morning. But if I get later in the day, it's not a good source of vitamin D3 for me.
Yeah.
No,
I totally agree.
I kind of have a silly question. If you're taking the D3 supplements on a daily basis, and you're also spending a lot of time out in the sun, are you setting yourself up for some problems there?
So first you need to check out the dosage of supplements you're taking. So just pull out your medication from the box and just check how much vitamin D3 are you taking as supplements. So if you are taking a maintenance dose, that's perfectly fine. But if you're taking a 60,000 dose every day, then you are leading up for hypervitaminosis or toxicity levels.
So if like you're going to a beach one day and you typically take like a 1,000 milligram supplement, maybe the day that you're going to the beach, you don't take that supplement. Yes?
Once in a while, you're not going to beach every day. So if you're going in once a week or probably twice a week, that's okay. You don't need to change your daily routine.
Oh, okay. So
because
our intake just got it.
Because in those vitamin tablets, you have other vitamins also. So probably you get a very good Kirkland products on Costco, so which are good supplements for vitamin D and other vitamins.
Yes.
Good. So really good, useful information. Thank you very much.
Thank you.
And made Sarah and me much happier.
Truly. My fever's gone.
Nick, we can't hear you. We can't hear you, Nick. So, Dr. Rajat, the situation in metros in India is bad as compared to the other cities and states we have. So, what do you think? How long it will go like this, basically? Because every month we see that next month is a peak and next month is a peak and things like that, and cases are growing like anything. So, what are your suggestions at this point of time?
Nothing. Just hold on. Just do what you can at the best. And I think it will go on till August end, probably first week of September. It will probably push a couple of months more, and then it's going to go down, because at the end of the day, probably all of us will have herd immunity, and all of us will be infected at some point in our routine. So let's see. Let's just hold on as much as you can, but again, be prepared that it can happen to you any day.
And Dr.
One question, Doctor. Sorry. One question. It was about the 11 strains that are there in India, and we have a large population. So, and if you look at the probability of each strain mutating, you're looking at given that's an RNA virus, we could. And my assumption is that RNA viruses mutate faster, but I do not know how valid that assumption is. Are we looking at how deep will the saturation point be, for the population to gain herd immunity? That was the question that came to mind. Physicist and mostly in mathematics and things like that. So I'm just looking at from a statistical point of view. Just wanted to send you out on what your thoughts are.
See, somebody was asking me a few days back that do you have relapses or recurrence with coronavirus? So again, it's we don't have relapses with the same strain, but you can have infection with the other strain or a mutated strain. So probably we have to see, and nobody knows. The thing you're asking me, I probably would not be able to answer, because we still under presumption and assumptions. I really don't know what will go on.
It was just it was a thought that came to my mind. I'm sorry.
I mean, probably because of all these strains, we are having a huge number of cases coming in, and we are seeing even youngsters being affected and dying because of corona, while there is no concept of high-risk patients now. Everybody is high-risk patient. So I think probably depends upon the strain you are infected with. If you are infected with a bad strain, that might be fatal for you. But if you're infected with a mild strain, you might have no symptoms or mild symptoms. So again, everything is on hit and try, and that's why the delay in vaccine is all about. So probably nobody would be able to comment as of now what's going to be like peak like, and I presume it's going to be till August 10 or September. Let's see. I hope it finishes faster.
Mm-hmm. And Dr.
I'm
Rajat,
dying to come to India and see my mother. That's why.
No, Rakesh, you're stuck in Hong Kong.
They are starting the international flights from 15th of July.
Right.
Okay.
So you're just going to have to stay in Hong Kong, Rakesh. That's it.
So do you anticipate a second wave to come around then?
Sorry?
Good question.
A second wave?
Good question. Good question.
Thank you.
We can expect that to happen again.
Yikes.
But the second wave is something which affects to the people who have already suffered from coronavirus, or it will be a second wave with new symptoms?
Probably a second wave with new strains and new symptoms.
Okay.
So boy, that's something to look forward to, right, guys?
Oh.
I'm floating on air right now.
New strain, new symptoms, second wave. So what about the vaccine that is being promised between now and the end of the year? Will the vaccine cover all the strains, or will the vaccine have only maybe a 50% effective rate? In other words, are these first generation vaccines going to be not 100% effective? What's your thoughts on that, or what have you seen on that?
I probably agree with you. I don't think that they would be 100% effective. It's practically not possible for them to make vaccine against all these strains. So
Yeah.
let us see. Like the vaccine which is made in Spain probably is more effective for people or patients in Spain which have a different strain than what they have in India. So probably it would be like a continent-wide or a country-wise vaccine coming in.
Right. Okay.
And you know that this could be an opportunity for a pharmaceutical company to be $1 trillion company, because there are multiple vaccines for multiple symptoms, and there might be a couple of companies or maybe 4 or 5 companies who can create more vaccines during Corona era, and they can be $1 trillion companies now, because once they have vaccines, everyone would like to buy it around the world, and that could be for multiple symptoms. So that's how we look at it as a positive side, that a lot of companies are still working on it. I was reading an article that around the world, we have around 25 or 27 countries who are working on the stage of almost giving their suggestions to the government and trying to get their patent and all those things done before they come out in the market. And Remdesivir also have tied up with a couple of pharmaceutical companies in India to sell their licensing, and those companies are making the vaccines in India. And they have even come up with the cost that the vaccine would be under $100. But they still have a lot of trials and a lot of. I mean, it looks like they still have 6 or 8 months before they come in the market. But on the other hand, I would like to ask Dr. Rajat. Dr. Rajat, you know that during the monsoon, we have a lot of other disease and viruses and dengue and all those things going around. So do you think this is the time we should take all those vaccines for those things, so that we at least get immunity from those diseases? Because I was reading an article somewhere on a medical journal that if someone might suffer from dengue or something during the monsoon, that person is more prone to coronavirus because the immunity is already weak, and that person can suffer from coronavirus as well. So what do you think about that?
Yeah, I totally agree. I believe that this Corona thing has made people very medically aware about things and very conscious about their health. Like I never expected you or me to go for an influenza vaccine or some vaccine near the monsoon period, thinking that we are young and we would not be infected. But it has brought a scare in all of us. So because anybody can be affected and anybody can have fatal symptoms. So yes, advisable to get all the vaccines for common problems during the monsoon in India, and because again, it's all about immunity. So, and mistaken identity also, because if you have symptoms, you might be taken as a corona positive patient and might be sent to a corona ward, or you don't know. So you have to be like pretty sure that you're suffering from corona.
I have a question that I'm not sure that you, Dr. Gupta, you can answer this, but there are many conspiracy theories floating around, especially on the internet. You can't go on the internet without seeing another conspiracy theory about the source of the virus. And my favorite one is that it's Bill Gates, because he's going to make money off of the vaccine or something like that. But there's many variations on the same theme. And is there any scientific basis for the source of this virus? Because viruses don't care about how much money you're going to make off of it, but so they must have originated at some place. And do we have that as a scientific evidence of the source?
See, the scientific evidence to the source is it's a zoonotic disease, so it has definitely come from animals.
Yes,
and probably bat is the source of infection, and people who are handling bats or eating bats, especially people in China, probably got infected. So zoonotic diseases are diseases which are transmitted from animals to humans,
right,
who are either handling those animals or eating or slaughtering those animals. So probably that had been the source of infection, and then there was human to human transmission through droplet. And so I guess this is the only scientific evidence we have. Like we had a similar thing occurring in the Middle East, the MERS, which was more in camels. Again, it was a zoonotic disease. So it was more in the Middle East, and it came from camels. So this new COVID virus, which is Corona 2, this is like coming from the bat. So this is the only scientific evidence.
because
we all know.
Yes.
We know in the divided states, we know that there's a swine flu. That was the most famous one for us.
When pigs fly.
And so the transmission from animal to humans is just a scientific fact.
Yeah.
Am I correct in saying that?
Yeah, so, you're correct in saying that.
Yeah.
So this isn't something that we should be blaming anyone about. This is just
except for
I don't know about I don't know about the conspiracy, because there has been rumors that this was deliberately being spread among humans, and last year being the leap year, and there was the New Year celebration occurring in a certain part of the world, and people were gathering there, and there were infected corona patients, and then it spread all over the world from there. So again, there are conspiracies.
Because you come to celebrate, and you're causing a spreading event, a super event.
Yeah.
So basically, the whole world would be better if we all became vegetarian.
That's Sarah's point.
I was just wondering, I heard of this Moderna vaccine made in Oxford, which is focusing on the spike protein. And I was wondering about when you have these 11 different strains and strains, maybe in other parts of the world, how much is the commonality in the spike protein? Because I believe the Moderna virus sort of blocks out the spike protein so it doesn't hit human cells. And so I was just wondering if there's no commonality in the spike protein, or if there's some variation, how effective. To me, that made a lot of sense. That's why I'm interested to know, to have a vaccine that hits the process of transmission by blocking out the spike, which helps it enter human cells. So if we could, if we have any knowledge about, I'm just throwing out the question in the air, that if there's any knowledge about how common the spike protein is across the various strains, just throwing the question up in the air.
I probably have no idea regarding this, and to be very honest, and I don't think much people around the world, or even the scientists, have much idea about how commonality is there between the spike protein. But we presume and we pray that there is some commonality, so that vaccine is useful for all parts of the world. So that would be like a major boom if there is one. But again, it's under research, so probably it's too early to comment.
I don't understand how that would even work. I mean, it doesn't allow it to come in contact with the human cell. So I mean, like if you had a glass of water and you had some sort of vial that had a contaminant of coronavirus in it, and you put it in the water, and then you put that water all over your hand, how does that spike interact to make it so that virus doesn't? You see what I'm saying? Like,
that protein locks in with certain receptor cells in our bodies. So that's how it enters our bodies. So the spike protein is like, there's a little covering for the RNA inside, and the proteins is if you've seen the pictures, they're all little things, just like like an old marine mine that was used for ships. So it's something which locks in with our cells, and then once it locks in with the cell, then it opens up the cell, RNA goes in, multiplies. So the Moderna vaccine is, because of it wants to avoid, this is the 30,000 base pair RNA. So it's trying to avoid getting tangled up with that. So it's trying to stop that RNA from getting into our cells in the first place. So that's how that vaccine sort of works. And I was hoping that, because they're pretty decent. They tied up with one of our labs in India, in Pune. And I'm sure they've tied up in each country, the prominent manufacturer, where they're sort of literally sharing the technology to manufacture that vaccine. So far, it has had good results. but we know it's very early days. So I'm just telling you whatever I know. I'm not an expert. I'm a physicist, not a biologist. So I'm
Sounds super
confessing.
close to an expert, though.
Yeah. No. I'm not an expert.
The
Yeah, so.
coronavirus entering our bodies, so it can't get out.
But
Yeah, just to keep it inside that block, that little sort of.
Here's what the dummy is hearing. You say, Rakesh, and it's a spike that penetrates our cell, and so the vaccine is blunting the spike so that it can't penetrate.
It sort of blocks off the spike. It's a molecular block to the spike.
Right.
And that's how it prevents it from working. This is what I've understood. Again, as I say, I'm a physicist. I just study a whole lot of things and try to make sense of it. Right. There will be some molecular biologist who can tell you much better, more sound explanation. But this is my understanding.
Humble and smart. Look at that.
No.
Yeah, I only got one of those too. I got to work on the humility.
Dr. Warrior, I'm so pleased to see you, Dr. Warrior. Dr. Gupta, really pleased to meet you too again. I've seen you before.
Yeah.
So we have Dr. Ramesh joining us from Kerala, and he's an Ayurveda specialist. So, Dr. Ramesh, what do you have for us? How's the monsoon in Kerala?
Oh, it's gaining strength now, and almost every day. That is why I had a problem to get connected. The internet was out of order, and somehow I got it corrected because of the heavy rains here.
Yes.
Yeah. Yes.
And how is Kerala coping up with the current situation?
You mean this virus issue?
Yeah.
Virus issue, definitely it is getting bad because lots of people from abroad, especially from Gulf countries, are coming here. Government is trying to take care of all of them, but unfortunately, people, I don't know, somehow they feel that they don't get this virus, and the discipline, the social distancing, hygiene, and such things are lacking many places, and naturally the number of cases are increasing, but still in a controlled way. So we are all hoping that actually we won't be having a very bad scenes like in Delhi, Maharashtra, Tamil Nadu, and all we are facing. Still, it is well under control, and our healthcare system is functioning very, very actively, dynamically. So we are hoping for the best. Yes.
And before we start the conversation, I think Dr. Rajat needs to leave. But to our viewers, I would like to introduce everyone again. Dr. Rajat Gupta is joining us from Delhi. He's a pain specialist, and he runs a clinic, Orlin Clinic, based out of Delhi. We have Jim, and he's a chess professional. He runs a lot of shows on IBM TV. One of the shows is Chess Without Borders, every Tuesday, 1 p.m. EST. We have Rakesh Krishnandi. He joins us from Hong Kong. Shared the expertise about science, maths, English, and a lot of things. And he knows a lot of things about the world as well. And people are always eager to know what Rakesh has to say about this topic. We have Sarah joining us from Illinois, and she's part of IBM. And then we have Dr. Ramesh, and he's from Kerala, and he's one of the Ayurveda specialists we have in India. And Dr. Rajat, before you leave, I just wanted to ask the simple question again, because our viewers are now confused, and a lot of people also. How coronavirus spreads in the body? Is it still the nose and the mouth, or is it about ears and all those other things as well?
I heard it goes to the eyes too.
So it's basically droplet infection. So any form of droplet infection and cough, sneezing. So you have that microsomes, the droplets in the air. Or from the surfaces, if an infected person has touched a surface and you touch that surface, you might have corona infection on your hand, and then you touch your eyes or you touch your nose or rub your so you can get infected through that. So that's why they say that whenever you touch a surface, so keep washing your hands or use alcohol-based sanitizer. They say that for healthcare professionals, if your hands are soiled, if they're dirty, then wash it for 30 seconds with soap and water. Or if it's not dirty, you visually not dirty, then you should only rub it with soap and water and wash it for 20 seconds. So all of us should keep wearing masks, keep washing hands, avoid touching unwanted surfaces. And so droplet infection is the only source. So just be careful. And if you cough and you sneeze, what is that?
Room sanitizer.
Room
Sanitizer.
sanitizers.
Basically, what we do is whenever someone will come home, so we just spray, apart from using sanitizer, we just spray the body and just spray wherever those shoes and all those things. So make sure that we have enough protection and enough arms against the virus. But Dr. Rajat, I have a question that whatever you are saying, that's perfectly fine. But still, a lot of viewers would not able to understand that it's not a touch virus. It's not something where you touch someone and you get a virus. But if you touch and then you use that in your eyes or mouth or then something like that, then it goes inside your body.
See, I shake hands with you. If I touch a surface and I then touch my mouth, I tend to take the infection inside. So this is how it is. So when you have a mask, so it not only protects you from coughing and sneezing and throwing out droplets, but it also avoids you touching your face. And that's why they say always keep the mask above your nose till your chin. So it avoids you. That's the way Jim is showing. This is how you should wear a mask. So it has multi-purpose. And in terms of your sanitizer you were showing me, I don't know the reliability, how effective it is, but I would still recommend that keep washing hands with soap and water.
This is the sanitizer for products basically. Whatever products comes in, we just spray on that product. This is not for humans. This is just a for them basically.
My wife does that also.
Apart from sanitizer, so I try to wash my hands around 20-25 times every day to make sure that it's clean and healthy.
And there are certain people are very smart. What they're doing is, if you get a product from Amazon or if you get something from outside which is not perishable, they keep it out in the room, in a separate room for 7 to 8 hours, and they don't touch it, so that the virus on the surface dies. And then the next day they open it and use it. But again, it's not perishable like milk or curd.
So we keep
my
it
wife
outside
sprays it with isopropanol
to make sure that sun will contaminate or sun will kill all those viruses, and we will consume it after a point of time.
The whole idea is just not to touch it for 6-7 hours. They say that the virus is present on the surface for 7-8 hours. So after that, you can touch it. So the whole idea is that. But again, so just keep doing what you're doing and hope to see you well. And stay healthy, stay safe. I'll take your leave.
Thank you, sir. Thank you.
Thank you, sir.
Thank you.
Thank you, everyone.
Namaste.
We would like to see you next Friday on IBM TV, and thank you for joining us.
Thank you. Keep taking vitamin D and just check out the strength of vitamin D.
Vitamin D here.
Thank you, sir.
Bye-bye. Thanks.
So, Sarah, go easy on the D3.